Hi everybody, it's Andy Perwin with ACS Business Insurance Services. I'm here with Grace Butler today, and it's time for another bi-weekly healthcare reform update. Some of the things that we're going to talk to you about today are some of the information we've been gathering from different sources. We're going to talk to you a little bit about some of the information that was obtained from our National Association of Health Underwriters. Grace is going to go ahead and jump in on that, and we'll go from there.
Absolutely, I will. Thanks, Andy. Just a little bit on the healthcare reform update. There are new reporting provisions for W-2s that pertain to employers with over 250 employees. They are required by federal mandate to list how much in health benefits that they provide throughout the year for their employees. So it's kind of taken on a whole new role, big task for HR people. Sorry, we didn't write the law. So that's been a big piece of it. So there's been a lot of questions about what will happen with individuals in regards to insurance and not providing or not having insurance and that type of thing. So I wanted to tell a little bit what has come down for the health reform for the individuals. So in this, I'm just going to read briefly. It says, starting in 2015, individuals filing a tax return for the previous year will indicate which members of their family, including themselves, that are exempt from the health care provision. For family members who are not exempt from the provision, the taxpayer will indicate whether they had insurance coverage. For each non-exempt family member who doesn't have coverage, the taxpayer will owe a payment. Pretty interesting. Yeah.
Very interesting, guys, because that leads to a whole slew of questions. What does that mean? Typically, it's going to mean that if your coverage through your employer covers you and your dependents right now and you can't afford that, then you're going to be able to go to the exchange or the open market at that point. But more importantly, it really is an indicator that the taxes are going to be charged. There was a lot of conversations about how the tax would come into play. So they're kind of ironing out through IRS mechanisms a way to tax those that do not have medical insurance coverage. The other thing that comes into play is that the exchanges are going to be opened in October of this year in regards to when you can enroll. It's going to be October, and the effective date is going to be January. And Grace is going to elaborate a little bit more on that subject.
Right. We're not going to know. First, I'm going to go back a little bit to the W-2 reporting. That kind of solidifies that if healthcare reform begins January 1st of 2014, that in essence means that the clock is ticking for you to get your individual coverage in order if it isn't provided by your employer. And then by the time the filing sets in 2015, then the IRS will have known throughout the year if you've had your coverage. So that's kind of an interesting thing to note. So that is how they will technically police it, because there's been some questions about how they would know that. In regards to the exchange being set up, even though it is October 1st, we as brokers won't have any of the rates or any of that, because we will be able to access that market for you as well. But the Department of Insurance, that is actually the commissioner is actually the one who is setting up the exchange and all of that for the state of Nevada. They are not going to have the rates from the carriers until June or July, and so we probably aren't going to have those rates until August-ish. There's a lot of issues with healthcare reform. So stay tuned. We will have some rates and we will have some more updates for you on this one, but we thought this was an important part for you to have an understanding of where it was going.
Thank you. Thank you again for watching our bi-weekly update. We're doing our best to keep up on this, the information that we're reading. And if you have any questions, please get in touch with us. We can be reached at 775-425-3233 or on our website at acsinsurance.com. Thank you again for watching this week's or bi-weekly healthcare reform update.
Thank
Thanks.
you.